Good afternoon, everyone, and welcome to the Greater Fort Lauderdale Alliance Business Leadership Virtual Town Hall meeting. It's our 8th Town Hall meeting in the last 8 weeks. I am Juliette Rolak, Chair of the Greater Fort Lauderdale Alliance, and I'm pleased to be serving as your host this afternoon. Today, we will continue to provide an update of the latest information available regarding business continuity and recovery during the COVID-19 crisis. We have seen the county slowly reopening parks, and we remain cautiously optimistic that as Broward seems to be beyond its peak, we will be able to gradually phase in even more openings, as our sister counties to our north and west have already begun to do. We hope to share as many facts as we possibly can in our time together today, and our experts will be able to provide answers to questions that are important to members of our business community. To everyone attending, thank you for what you continue to do for our community, your companies, and your employees. I know that several of our member companies, like Florida Blue, FPL, JM Family, are giving back to COVID relief initiatives. I just saw a news story yesterday that Salvation Army in Broward, one of the food banks that FPL recently donated to, is already running low on food supplies. It is so very important to remember that food security is increasing, and we urge other companies to continue to do whatever you can to support our community. Well, we have 5 fantastic presenters today. State Representative Lamarca, our county administrator, and experts in children's services, banking, and healthcare. We will be taking questions throughout the meeting. If you do have a question, please send it to us by way of the chat button at the bottom of your Zoom meeting screen, and we'll get to as many as we can. Again, just send us a chat and we'll take your questions there. And with that, let's get right into our meeting. I'm very pleased to call on our first speaker, State Representative Chip Lamarca, who has a great perspective from both the state and local levels. Prior to his election to the Florida House of Representatives, Chip served on the Lighthouse Point City Commission and then Broward County Commission. Of course, most importantly, is a member of our Alliance Board. Representative Lamarca, please, we welcome you.
Thank you, Juliette, and thank you for inviting me back to be on the Broward Business Leaders Town Hall. It's a privilege to be on this call and also be back on the Greater Fort Lauderdale Alliance Board of Directors and serving as your state legislator. I wanted to give a few updates if I could and kind of chat a little bit about what's going on at the state level, but really it's so integrated with what's going on locally here. And so the first thing I want to chat about a little bit about is the reopening of businesses and how that will happen safely. As you know, in phase 1, Broward and Miami-Dade, Broward, Palm Beach counties are not in that order. But we believe from conversations with the governor's office and his team and staying updated with them that these 3 counties will be coming along soon. We've heard as close as sometime towards the end of next week, but I believe it's in the very near future. And one of the things that's popped up quite a bit, and I keep in touch with some restaurateurs and small business owners in our community here, is the restaurant issue. And I saw the governor allude a bit towards this yesterday when he was in Miami Gardens at the Hard Rock Stadium press conference. And that is that restaurants may end up being 50% open instead of 25%, because we've heard from some businesses that you can still social distance, but you really can't run a business at 25%. It actually costs more to operate it that way than just doing takeout or delivery. So some of those types of things, businesses and types of businesses that will open need to make sure that they're social distancing and following the CDC guidelines. I know we'll hear more about that from our healthcare experts, but from the standpoint of the actual business opening up, it has to make sense to do that. So clearly the best way to do that is have the business community's input. One of the other things I'm proud to have seen happen it kind of happened quietly, because last Friday, the governor opened some state parks, and we really didn't have any here in Broward that were opening. And Miami-Dade, I believe, had one in the Everglades park, but we did find out, and after conversations, a little more prodding over the weekend with the governor's team, that Birch State Park did open on Friday quietly, and we made an announcement on Monday. As a matter of fact, I think after this webinar, I might go over and walk the 2.5 mile track, because it'd be nice to get out. But we are seeing other activities happening, a lot of boating, a lot of other outdoor activities, just where they can and where people can maintain social distance. As a former, as you'd mentioned, city, we'll call it local elected, but city and county elected official now working with the state, one of the things that I've found to be the most important benefit of having that experience is looking at our region, looking at our tri-county region, and also looking at working with the cities and the county, and trying to make sure that as we do the reopening, especially with businesses, that the orders, that the deluge of orders that were sent out not only by the state, but by the county and then ultimately by cities as well, are clear, that folks know exactly what they're doing when they open a business. And we've kind of had that conversation at the Broward County and the delegation level. Are we reaching out to businesses based on their local business license or tax license and saying, hey, this is the date you can open and here are some guidelines for it. So kind of working with the local governments on that is really important. And then the third thing has been probably, the health and safety and health and welfare of our children, seniors, and everyone in between in Broward County is my top priority. Clearly, there's nothing that will replace that, but it has been, as you can imagine, especially on this call, it has been gut-wrenching to watch our economy and our local businesses go through what they're going through, and then the individuals that are employees. And one of the things that we've spent quite a bit of time on, matter of fact, I just got off of a webinar of how Rhode Island dealt with the unemployment system situation, and trying to make sure that we're addressing those. As of today, we are over $1 billion in funds paid and unemployment claims paid, both state and federal, and we're at about 500,000 Floridians having had benefits paid. It's still just not good enough. At the end of the day, this has been really what we spend a great deal of our time on, and that's making sure that people who have never, by fault of their own or even by an economy outside of this one, have ever had to go to the government for anything. And it's our privilege to help them get through the system, but it is still very quirky. And part of the problem early on was that some folks had registered 2 and 3 times. They'd gone on, they hadn't heard any news. They sent a paper application when that became an option, and then ultimately they went online and did it again. So part of the problem is, as you can imagine, is removing the clutter, the second application, the third, the triplicate and duplicate issues. So that is moving better today. I cannot tell you that it is perfect by any stretch, but it is monumentally better than it was 2 weeks ago, and folks are getting paid. So I would recommend to anybody on this call, with respect to their employees or themselves, if you're not getting benefits connected to you and either direct deposit or sent to you, please reach out to your state senator or your state representative. That's one of the things that all of our offices are spending quite a bit of time doing. So I remain here for any questions and concerns about anything else, and appreciate, again, you letting me be on the call.
Absolutely. Thank you so much for all that you're doing there. It's really helpful to have your local experience and to share the challenges with the practical considerations of implementing many of these restrictive guidelines. So we really appreciate that. And oh, by the way, many heralded the opening of Birch State Park. I think that was big news for everyone.
Appreciate it, Jill. Let me throw one plug in, if I could. The fact that our May bills are coming from your company, and we do see a 25% reduction because of fuel costs. So that was a really good, timely effort by FPL. I think a lot of us are going to appreciate that.
Thank you. That's always appreciated, but particularly now. I really am happy we're able to do that. So hearing a little noise out of Palm Beach County, saying that they are ready to join the rest of the state, and just wondered, 3 of the counties, our South Florida, were excluded from the governor's phase 1, and now Palm Beach says, let's join the rest. How is that? is that looking like up there? If that happens, what do you think we need to do as for South Florida, you know?
Well, so Palm Beach has issued a letter, so they formally stated we're ready to open. I have not seen that unless it's slipped by me. I have not seen that from Broward County yet. I know that they're close, and the number, the percentage of cases and testing is getting better. If they do that, I believe the mayor of Fort Lauderdale had asked to be excluded, but I just don't think that 1 out of 31 cities would be excluded, no matter the size or scope that the city is. I think that the League of Cities and Broward County need to work together and make sure that they can offer that same statement that Palm Beach did and say we're ready to open. I think it would be, I don't want to hold anyone back, but I think it would be the wrong decision to not open the Tri-County area together. And I think we're close enough to be able to do that. I think from a business perspective, as well as public health and delivering governmental services. So I think that's an important distinction. I think we should probably try to do it together. I did see on the question from our friend Ina Lee was asking about the budget. The governor has not signed. Well, actually, I take that back. The full budget is in effect. Visit Florida is funded at the $50 million level, and it's out into 3 years, but we haven't heard anything after that, Ina. And I know that's probably, this is probably the most important time to illustrate how important Visit Florida will be as we get people back to Florida. So we're really going to see why tourism marketing, in my mind, is a critical part of who Florida is.
Yes, I really appreciate those comments, and I think you're right. You know, coordination is going to be key, so it would be difficult if Palm Beach kind of stepped away, given how close the boundaries are. So something else we're seeing a concern about is unemployment benefits. Is there any plan to extend employment benefits beyond the 13 weeks?
You know, I need that's something that they're looking at right now. They were made retroactive back to March 9th. So depending on when someone was separated from employment, if it was anytime from March 9th after, you'd get the benefit of that date, which goes back really till we voted on the budget in Tallahassee on March 19th. So it was 10 days prior to that. And I think there was conversations about early March. So March 9th is the retroactive date. We're trying to figure out what the end date would be if we can extend it. I know the federal benefits go out, I believe, till July 31st. So that's some runway in front of us there. But that's something I will definitely get some additional information and get it back to you guys so you can report it on the next call.
Well, thank you so much. We are going to move on, but we will hopefully have some time at the end of the call to ask some more questions. So at this time, we would like to welcome our next speaker, who will provide an always important health report and hospital update. We have to welcome the Chief Executive Officer of Baptist Health South Florida Medical Group and former president of Cleveland Clinic, Florida, Dr. Bernie Fernandez. Dr. Fernandez, Baptist is certainly growing its presence here in Broward, and it's really great to have you here. Please do share.
Thank you. Thank you for having me, Julie. Nice to see all of you. I believe I have a presentation. If Maggie, if you can bring that up. So just wanted to share with you some of the things that we've done at Baptist Health, both in response and some of the innovations that have come by way of this pandemic as well. If I can have the next slide. Let me not forget, most important, we are celebrating Nurses Week, and there's not enough things that we can say great about our nurses who have been really the front lines. From a personal professional development, I can tell you that I learned as much, if not more, from many of the nurses who brought me up as both a medical student and as a resident. So my debt of gratitude, and all of our debt of gratitude, goes out to our nurses and as our frontline heroes. Not enough, again, praise that we can, any of us, provide for the job they've done, putting themselves in the line of duty. Next slide. So our response has been something that has been well coordinated as across the entire system. We've had experience, obviously, dealing with the hurricanes and calling our emergency preparedness team all together. Make no mistake, we've looked for guidance from the CDC, and we're constantly in conversations with both the Florida Department of Health, ACA, and following very closely the CDC and our local Department of Health, all really working together in a very nice coordinated fashion. Let me also make everyone aware that the collaboration has been really very heartfelt between all the different health systems in South Florida. I don't believe that there's been a moment that we've done better, and something that we can all be very, very proud of. So that has also been very critical in doing so. Next slide. A little bit of the current status. In fact, I looked at the website again this morning. We just surpassed over 38,000 cases for the state of Florida. The deaths have increased now to 1,539. There's no doubt that Miami-Dade County leads the way in the number of cases of just over 13,000 cases. For Broward, which is of interest to all the ones on this call, as of this morning, the Department of Health listed 5,677 cases. It appears equally to involve both men and women. Hospitalizations are about a little over 1,081, so approximately 20% of all the cases. And the deaths, unfortunately, we've lost 230 of our citizens to this, which is about 4% of all the cases. And that seems to be pretty much holding the same, about 4% statewide. And Palm Beach is a little blip, a little higher, perhaps because of the age of the population. Or those afflicted, it's been about 16% of the cases, and the deaths have told about 6% of all the cases in general. So that was as of this morning. Obviously, I also looked at the curves, and that's something that Baptist follows very carefully. Particularly now as we begin to open, we rely heavily on our own internal and external statistics and working with our partners in the community to follow the cases. And universally across all the counties in Florida, and definitely those in South Florida, the trend continues on the downward trend. We concentrate obviously on the deaths. Also, we look at the hospital capacity, making sure that if there is a second wave, which I cannot, I'm not an epidemiologist, I cannot predict, or we're going to be prepared. So we're constantly monitoring our hospital capacity. We talk about the fatalities. I think we also need to talk about the positive things that have occurred. So more than 600 COVID cases have actually been discharged from our hospitals. So some good things are happening to patients that do need hospitalizations. Our physicians continue to practice, at least those from the Baptist Health Medical Group. We never closed our doors. We did them in a safely manner, although we did move to a virtual environment, and we'll talk about that under the little bit of the opportunities and innovations in the next couple of slides. Next slide. So some of the innovations that have come away of this pandemic, in particular for us, our Miami Cancer Institute, and we have a molecular lab, we were able to develop an actual COVID-19 test. That was the first one to receive in South Florida the approval from the FDA, and only of 12 hospital laboratories across the country to receive this authorization. So that increased, particularly for our at-risk patients, those with cancer, increased capacity to be able to do that in a timely manner rather than waiting for 24, 48 hours, so we can actually do it within the 24-hour period. So again, some innovation coming as part of this pandemic response. Next. Advances in the treatment. It's exciting to see some other things beginning to occur. I'll start with the bottom first, the plasma therapy. Baptist Health has joined the Mayo Clinic research protocol for convalescent plasma. Those are the infusion of plasma in patients who are recovering for COVID-19, who develop antibodies, and we can transfuse them for therapy. We have done upwards of 70 or so patients that have received this convalescent plasma. It appears to be a very positive response thus far. The other one, the stem cell therapy, is something really quite innovative, and we have the only trial in the country that I'm aware of. Just received, in fact, today, approval from the FDA to formally make it into a clinical trial. This will be done with another organization, and this is using umbilical cord mesenchymal stem cells to combat what is known in the medical literature as a cytokine storm. These inflammatory cells that produce these proteins that modulate inflammation, and the response of the COVID-19 virus appears to cause an zealous immune system response, and that is what begins to cause the damage of end organ damage in patients' lungs, kidneys, and other organs, causing the multi-organ failure. And using these mesenchymal stem cell infusions appears to modulate the release or temper the release of these inflammatory cells, allowing the body to heal itself in a more controlled fashion, if you will. So this is pretty exciting, and like I said, we just have done, I believe we've done 3 patients thus far, and we just really received clearance from the FDA to do this into a clinical trial. Next slide. Telemedicine. Who hasn't heard about telemedicine during the pandemic? Before this, people were, in many circumstances, joking that it's going to be Star Trek, etc. Well, during the pandemic, one of the things that I'm extremely proud of our organization is that we released the Baptist Health Care on Demand free to our community. People could go on, and rather than crowding urgent care centers and the emergency rooms who were dealing with patients potentially that were real sick with the COVID and other more critical conditions, the community can actually access our Care on Demand platform and do a free virtual visit to see if we can move those patients that had other things that we could take care of easily, and then begin to screen out those that could be quarantined at home if they had mild symptoms, or we can refer them to the emergency room or the urgent care centers. So I believe we have upwards of 25,000 or so of these online visits. I know that I contacted several friends of mine who run businesses in Fort Lauderdale and particularly restaurants, and I offered them to their employees to take advantage of. So that was pretty well received, and like I said, I'm very proud of what this organization has done in providing that as a free community service. Besides that, it also includes some mental health counseling. It's something that we tend to overlook during these episodes, the amount of stress, not just in the healthcare providers, but also in our community. People are dealing with things that they don't understand, or many of our residents have comorbid conditions, and the specter of having to deal with that infection that can cause their demise. I keep hearing about morbidity and mortalities, etc. It becomes a daunting problem to deal with. So even our Care on Demand has been able to provide some of that counseling. So, and go to the next slide. So now we're moving into being part of the reopening of our services. So Baptist Health is under the leadership of Bo Bollinger, who's the Chief Operating Officer, went ahead and created the recovery task force, and we call this developing our own recovery playbook. It's about 150 pages that are within Baptist Health that actually covers soup to nuts, and essentially anything from a patient walking in, trying to make an appointment, or how do we clean our offices, how do we develop spacing, etc. It's all there, very nicely laid out for our own internal playbook. Next slide. Most important thing for us, obviously, in the healthcare field, our top priority is not just the safety of our patients, but also our employees. there's no doubt that if we cannot maintain our employees healthy, we're not going to be able to take care of the patients. So these go hand in hand. Some of the precautions we've taken, I've got a few of those photographs. For example, limited visitations. And yes, we don't allow visitors in the hospitals. We've had a very nice donation from a company called KPMG that gave us over 200 iPads. And those iPads are being used so that any patient in the hospital is able to communicate using FaceTime or Zoom if need be with their families. That's been very well received. We keep monitoring our patient experience scores, and folks understand the situation with which we're dealing and are very grateful that we're gone out of our way to maintain that sort of engagement with the families members who are very critical, obviously, in the patient's improvement. We're checking temperatures, making sure everyone's wearing a mask, and making sure that we have enhanced our already cleaning and disinfecting practices that we've had prior to this. They're enhanced, they're more rigorous, they're more frequent. That we continue to, we've always had hand washing compliance. We're really being extra strict with that. Social distancing and friendly in the waiting rooms and causing people not to gather, et cetera. So we're making sure that that our chairs are put apart about 6 feet from each, not about, over 6 feet from each other. So we're being very precise in both queuing the patients and the family members. And obviously, as I mentioned before, remaining in a state of readiness is very important to make sure that we continue to monitor what's going on so we can provide the excellent care to our community. Next slide. This is just an idea of show you a picture of what parts of our playbook look like. And again, it's really that precise. We have gone and removed any potential things that we normally would see in a physician's office, for example, like magazines in the waiting room. We used to provide every single patient that came in and their family members with complimentary coffee. Well, the coffee is gone. Anywhere that you can have a cross-contamination from one patient to another, with making sure that that does not occur. We have a contactless registration. In fact, we're looking at other opportunities for patients to register completely remote to do it at the time they do this. So again, we're looking at innovative ways to make sure that we maintain a safe environment. Next slide. Again, this is just an example of some of what I share with you. Our waiting room looks like chairs 6 feet apart. We've added for our employees, our staff, the plexiglass shield. This is like at the time of the hurricane. I remember being a roofer was great. I think making plexiglass shields now, it's another business opportunity that we're bringing because of these sorts of things. Making sure everyone's getting their temperature checked at entrance, and then providing very clear cues. This is an example of someone on one of our signs on the floor, both in English and Spanish, reminding folks that they need to stand 6 feet apart, similar to what we have seen when any of us have gone to maybe to Home Depot. Next slide. And I wanted to leave you with this thought. This is an article from the New England Journal of Medicine. This is the Untold Toll. And in the medical community, this is what we worry about. We're concentrating a lot on the patients that, rightly so, that are potentially infected with COVID. But having shut down for all elective procedures and shut down for anything that is non-COVID related because of the pandemic, certainly will have an untold toll in our community of people that have delayed any screening types of tests, colonoscopies, mammographies, patients with cancer. If you read this article from the New England Journal, they describe patients with cancer and breast cancer that typically would have had surgery first, and second they would get chemo. Now are getting chemotherapy first and then delaying the cancer surgery later without really having any clinical data to back that decision. So these are the sorts of things that I'm worried about. We discussed it this morning in my meeting with our physicians as part of the Baptist Health Medical Group. We need to really concentrate on reaching out to those, particularly those who are most vulnerable. Patients with uncontrolled diabetes or hypertension, the elderly, to make sure that we get them back in as soon as possible, whether it's by phone calls or telemedicine, and making sure we continue to concentrate on that recovery. And with that, I'll stop.
Thank you, Dr. Fernandez. I have to begin by giving you a note of congratulations and a thank you. So first of all, congrats on the approval for the stem cell clinical research. That's pretty amazing. And we're glad to have it right here locally. And then, what Baptist has done with the free telehealth is tremendous. And I know that the telehealth that you had available was actually one of the first to launch, at least in Florida. So, kind of always ahead of the trend. And it was perfect that you were able to open that up to our community as a free service. So, I saw in some of those photos, one of the photos, someone taking the temperature of one of the patients in the waiting area. There's a lot of controversy and mixed reviews about whether temperature taking is actually really helpful in minimizing the contagion. Can you share your thoughts from a medical perspective?
Sure. We do know. Obviously, there are exceptions to every rule, but we do know that when patients are sick, when patients are febrile and they're coughing or just beginning to start with the illness, with that fever, they're more contagious than at any other point. Usually, it's about 5 days to 6 days or so about the start of the illness. So making sure that you're screening for fever minimizes the risk of those patients will have the ability to contaminate someone else.
Thank you for that. It's good to know that there's one more thing that we can have to help keep us safe. The other thing is now elective or non-emergency procedures. You referenced that earlier. How do you feel about hospitals now reopening for elective procedures, and do you think it's the right time to do so?
Well, we're following all the recommendations from the CDC, the Department of Health. And again, my concern, that's why I wanted to leave that New England Journal article as our guide. There are people who are not undergoing much needed screening procedures or surgeries that are being delayed. So we're here for them. And we just have to our duty is to make it as safe as possible when they come in to get that care that they so need.
Okay. Well, thank you for that. Again, we're going to move on, but hopefully we'll be able to ask you some more questions toward the end of the call. Thank you so much, Dr. Fernandez. So as Dr. Fernandez was presenting and sharing information, we got a call from our County Administrator, Bertha Henry's office. She conveys her very deep regret and apologies, but something has come up and she unavoidably could not join us. I remember last week when our mayor described her as the hardest working government official or woman, he said, hardest working woman in Broward County. So apparently that's the case, and we absolutely forgive her. So moving on, our next speaker is someone who is going to share information about the SBA Paycheck Protection Program and other banking related issues. And that is Jeff Klink, who is the Regional President of South Florida Valley National Bank. Jeff, please do share.
Juliet, can you hear me okay?
We can hear you great.
I've learned my Zoom lesson over the last month, like many of you. First of all, thanks so much for the opportunity to plug into this call. I'm sorry to hear that Bertha can't attend, but I've seen her speak, so I feel like I've got a little air cover not having to go after her. As you mentioned, my name's Jeff Klink. I'm the regional president with Valley Bank here in South Florida. I wanted to take a second just to frame up who we are as a company, not as a sales pitch, but just to kind of lay context for some of the data I'm going to provide to the group today. Valley Bank is a $30+ billion regional bank. We've been in business for over 90 years. We operate in Florida, a heavy presence in Florida, along with New York, New Jersey, and Alabama, which gives us kind of a unique point of reference as a company in light of the overall COVID situation. Knowing this is a Broward Alliance event and we're focusing on South Florida and Broward County. When you drill down off of our $30 billion in assets, and that's upwards of $30 billion in loans outstanding, along with $30+ billion in deposits on our corporate balance sheet. In South Florida, the team I work with, we oversee about $1.4 billion in commercial loans, and we hold approximately $1.6 billion in deposits in our branches, of which there are 12 in Broward County. So we're considered on paper a super regional bank. We're publicly traded. From a numbers standpoint, we're one of the top 50 largest banks in the country. What that all means, though, is we're tasked with doing a number of things, especially in times of crisis as bankers. And we've stepped up to that challenge in light of the overall situation here in the market. In terms of our mix on the balance sheet, we do a lot of work on the commercial side. About 90% of our loans outstanding are business loans or loans tied to real estate. Some of the areas we do a considerable amount of work in are commercial real estate, both investment commercial real estate and owner-occupied commercial real estate. Approximately 16% of our portfolio is C&I loans or working capital loans that fuel the growth of local companies. We do a fair amount of apartment lending. And then we're also active in that about 10% of our portfolio is consumer loans. So residential loans, whether it's refis or purchase sale, residential mortgages, along with an auto portfolio. So I mentioned all that. Scope is relatively broad. The markets we operate in give us a pretty unique vantage point. Pivoting to the topic at hand and kind of looking at where we're at market-wise, we've seen, as expected, a considerable amount of deferral requests. Deferral requests for mortgage relief on the residential side. And candidly, if a client calls and needs help with that, we're answering the phones and providing that relief. Same story on the auto portfolio, considerable numbers of auto loan deferrals. On the commercial side, which is where I've got more day-to-day and direct connectivity, what's been refreshing, frankly, is the folks that own and operate, make their living in commercial real estate on the investor side. So folks that own office buildings, retail centers, multi-tenant warehouse complexes in Broward County and the surrounding areas. I've seen them step up and communicate with their tenants. And as simple as it sounds, that communication has allowed them to really customize payment plans for companies that have been impacted. And the landlords and property managers that have had those open lines of communications and the relationships with their respective tenants, even prior to the crisis, they seem to be working through this much better than some of the other folks that maybe didn't have the direct connectivity with their tenants. The same could be said for the apartment arena. Obviously, we've seen rent relief in the news. I think the injection of stimulus money has helped out those landlords to the point where they're collecting a lot of their rent. And again, I think there's correlation between landlord or property management communication with the tenants and their collections at this point. Needless to say, we're definitely paying close attention to our portfolio and staying close with our clients. Outside of our industry, I think the key takeaway for us at Valley Bank has been relationships. Relationships matter a lot. That's something the Alliance obviously touts. That's why we've got 250 participants on this call right now, is we want to know what's going on in our respective communities, and relationships with folks like the Alliance in terms of being the glue for communication and information. That's super important. Communication from folks like Dr. Fernandez and Representative Lamarca on what's going on kind of ground floor in our county. It's critical. And what's been interesting is in the banking industry, relationships, I think over the last 10 years haven't been as important. We've been on just a tear in terms of market strength. Everything was running at 95 and in some cases plus occupancy levels on investment commercial real estate. It was plug and play. If you owned it, you were making money. You really weren't having collection issues. Business-wise too, we were seeing record profits. Frankly, we went into this virus, and I think it's going to help us a lot in South Florida. We went into this virus with corporate balance sheets in general. As a banker, I have the luxury of seeing tax returns and financial statements all day. It's nerdy, but it's fun. But we've got the luxury of seeing those financials, and companies were cash healthy. There was lots of liquidity on local balance sheets, lower leverage than I'd seen before. And I think that will really help us through this crisis. But the relationship component, when the government flipped on the payment protection program, or PPP program as we're calling it internally, and basically said, we're going to offer a lifeline in the form of those funds to businesses that have employees or a number of employees under 500 and hit real basic benchmarks. You immediately needed a relationship with not just your bank, but a banking team. And what's been really interesting is seeing how different banks have responded. Obviously, our bank jumped, and we were allocating we had hundreds of employees immediately working, 12, 15, 18-hour days to get up and running to service our clients. We didn't really have a heads up on how to navigate or process applications, which internally we knew we had to get that up and running in a very tech and client-centric way, which needed to happen quickly and also needed to happen in a way where we could take heavy volume of applications. So the reaction and kind of the ability for a bank to maneuver and work with their clients was really tested. And I think it's forced a lot of business owners to look at who their banker and banking team are, to the point where they're saying, could I call my banker on Saturday morning at 10 a.m. to get feedback? In this case, they needed feedback on their PPP application, or they needed to submit one. And I think a number of banks in South Florida really stepped up. Regional banks like Valley, community banks, which there are a number of here in South Florida, really stepped up and delivered for their clients. And that was a priority and something that we feel really good about. In terms of where we're at today with the program, obviously round one funds were exhausted almost immediately. And the headlines were a lot of the large companies that applied, that kind of got the glitz. But what I think that overshadowed was really the core small and mid-sized businesses that picked up the funds in round one that really needed them quickly. The program did deliver that for them. Where we sit today, though, is they obviously approved round two funds. Banks like Valley Bank allocated the same amount of time and man hours and personnel hours to get round two applications through, because we were effective in getting the bulk of our initial requests through and approved with round one. But we still had some folks that, frankly, we felt bad about, that we couldn't quite get into the eTran portal that you've all heard so much about and approved as part of the round one funding. Round two funding, they approved over $300 billion as part of that tranche of PPP funds. And it's amazing to me, but the dollar size and volume of requests have obviously tapered back significantly. And this is as of end of business on the 5th. There still were approximately $140 billion left in funds that you could access. So what that means is, if you have not accessed the funds and you need them, you should definitely make every effort to reach out to your bank or your banker and get your application submitted. Where we've ended up in South Florida is, I feel really good about the bank as a whole. We've had over $2 billion in PPP loans approved, which is amazing for a bank of our size. When you drill down and look at South Florida, though, it kind of gives me goosebumps a little bit. We approved and have closed upwards of 800 loans, and the total dollars tied to those loans is over $130 million. So that's money that stays here in Broward and the surrounding counties. It's injected right onto corporate balance sheets. And obviously, for those familiar with the program, a lot of the funds can go towards payroll and retention of employees, which I think will really prop us up in the coming months as we kind of get reopened and hopefully get back to quote unquote normal. What was also pretty interesting in terms of loan size, again, the $10 million cap, those big loans got all the press during round one. As a whole, our region, the average loan size in South Florida was about $150,000. That's core small business funding right there. And our median loan size was only $50,000 so far. So we're doing, real small micro loans, but they're critical micro loans for small businesses at this point. I've received a lot of questions on what to do now. Again, if you haven't received funds and you need them, reach out to your banker. If you are in a tough position where you haven't been able to get your application through, of course, I'd be more than happy to talk to you. Many of you have my contact information. If you don't, feel free to reach out to me on LinkedIn. I'm more than happy to assist, given funds are still available. And, I think just to kind of close out, I think South Florida is an amazingly vibrant economy. We went into this thing like everybody else. It was a light switch transition for everybody, but the corporate strength and the strength of our group and our communities, I don't think has ever been stronger. And, just in working with clients in times of crisis, I think it's brought, our bank closer with our clients. And I think it's really brought the community together. And on a non-bank related note, I'm sure Bob had something to do with this. I hear we've got the Blue Angels flying over tomorrow, right at 1 o'clock. So that's going to be awesome. So thanks for the opportunity. I'm happy to take any questions.
Thank you, Jeff. I will personally be looking out for the Blue Angels between 1 and 1:25 p.m. tomorrow. So thank you, of course, for Valley Bank for all that you're doing to keep our businesses alive. And I have to say that it was a really positive note to end on by sharing that the 800 loans that your bank has gotten approved will result in an injection back into our economy of 130 million. Believe me, we will appreciate every penny of that million going forward. A question that's often been asked is, what do you think you would change, or what would you do differently post-COVID? How do you believe the COVID will reshape the personal banking industry?
I think there's going to be tremendous opportunities for the banks that successfully allocated the hours and had the team members, which I'm horribly biased, but I think we've got some of the best bankers and people at our company in the industry. But seeing how folks really banded together to support the clients and support the bank and do things that were totally opposite of what they normally would do on a day-to-day basis was super impressive. I think in terms of impact, we're going to see continued consolidation, which we'd already seen in South Florida. We've had 40 quote unquote South Florida based banks get purchased by various regional banks and larger banks over the last 10 plus years. But I think we're going to see continued consolidation, not just of banks, but also of branches. I mean, I think this has shined a light on the fact that if you have a great tech platform and you have great people that will still interact with their clients, whether it's in an office or on a Zoom meeting, you can be real successful here in this market.
Well, thank you, Jeff. You're a great ambassador for the banking industry. Your passion for your team and your customers is palpable. So thank you so much for all that you're doing.
Thanks again. Great job.
Absolutely. Thank you. So moving on to our next speaker, who's here to talk about some of the questions the business community has about childcare, summer youth programs, and other issues facing companies and their employees. A leading advocate on behalf of the children of Broward County, we're fortunate to have Cindy Arnberg-Seltzer, the President and CEO of Children's Services Council of Broward County. She works there to transform young lives by supporting programs for children and families delivered by more than 100 provider agencies. Cindy, thank you all so much for what you do. Please do share what's going on.
Thank you, Juliet, and thank you, Bob, for including me in this. From the start of the Children's Services Council, we have known that the children and families of Broward County don't succeed unless the nonprofit community succeeds. And through that, we have helped, as you mentioned, over 100 agencies. We have built a pretty strong safety net under Broward's children and families, which has stood us in reasonably good stead given this current pandemic. Over the last 2 days, I have been on Zoom calls with the CEOs of those 100 agencies. And I have to tell you how amazed and proud I am. We've been in close contact with them all from the beginning of this pandemic to understand how they were responding and how we could support them in the best way possible to ensure that services were still delivered to children and families. And I know that this very caring Broward business community has cared about that throughout. So I want you to know that with almost lightning speed, those that were providing mental health and counseling services switched over to virtual platforms. Those that were doing after school programs for elementary, middle, and high school students switched almost immediately where they could to doing case management and feeding. That's not what they are normally tasked with doing. Yes, they feed the children in the after school programs, but just being a feeding program was not their method of operation. They have been doing tutoring assistance, virtual homework support, counseling. The Bridge to Life Committee is helping the graduating seniors find their way to college. A lot of services are going on virtually. But the question you asked me to address today is what happens as people try to go back to work, as you all put your lights back on and say, now staff, come show up. So I have good news and bad news. The good news is that all of those after school providers that, become summer camp providers are trying their best to find ways to meet the needs. They are following the CDC guidelines very carefully. They're watching the guidance from the state. They're working with child care licensing in the cases where the facilities have to be licensed by child care. They are sourcing PPE. We're helping them with that, as is the United Way and the Health Foundation of South Florida. They are getting their disinfecting houses in order, and they are working on that diligently. The bad news is that the capacity of these programs is going to be quite limited. We were exploring this morning, if Children's Services Council funds 10,000 children to be in summer camps. So most of those programs are holding a couple hundred children at a time. They don't have the space for that. So it's going to be cut, even those, and we have a problem with space that many of them take place in school buildings. The school buildings, we're still negotiating with Mr. Runcie to see which will be available, how many classrooms, etc. Remember, we're in a situation where you can't have more than 9 children with one counselor. So that puts an enormous strain on their ability to do that. We were exploring the possibility, in some, they may be able to get more classrooms where they have their own physical space, like the Boys and Girls Club. They can't add on rooms. They have to deal with what they have. Maybe some people will be able to, they'll alternate days, have maybe one group of kids on Monday, Wednesday, Friday, another group on Tuesday, Thursday, and then flip it the following week. Find ways to get at least some respite for as many families as possible. So I will say to you, the business community, if you find that your workers are not able to come back because they can't find childcare, they're not kidding. And you may need to accommodate that with a combination of work from home and their ability to put their children in some sort of care. For the younger children, there are currently 200 early care centers open, 492 that are closed. They are all surveying their populations to figure out if they will send their children back, even if they do open up. They are aware of all of those requirements and will be putting all due precautions in place. One of the ways the Children's Services Council has tried to help both during the crisis with the the child care, early childhood and school age care for the first responders is by providing nursing services. We have been paying for some of the child care up until now for those first responders and medical workers whose children needed it. But we've also typically paid for 9 RNs and 54 health support techs in the schools to be their school nurse. And we have redeployed them where they are willing to go into childcare centers or into the after school programs to do those temperature checks, to provide a little bit of security to those places about the medical care being offered. So some of those have agreed to do that. You had also asked me to talk about food and what happens to food during the summer. There typically is, so the food distribution has been tremendous. I'm sure you've seen a lot of it on the news. Feeding South Florida generally is the one that's featured, and they are by far the behemoth in the world of feeding, and they have been doing a masterful job. Every one of the feeding programs has had to turn their methodology on its head, meet amounts that are 300, 400, 500 times what they normally do. And they've just done a tremendous job. But we also have some of the smaller Meals on Wheels, the Flippany, Mobile School Pantry, Harvest Drive, that have also been filling in, as well as many of the nonprofits who have been sourcing food from some of those places and from their own sites in order to get the food out into the community. While the school feeding program dollars don't typically exist over the summer, there is something called Summer Break Spot, which will be deployed. That also goes through the Department of Agriculture and is used to do a great deal of feeding over the summer. And one of the challenges again is where to do it. And again, there's going to have to be a big shift. The feedings normally happen in congregate settings, and you can't do congregate settings anymore. So all of the logistical planning is going into place now to turn those into grab and go centers. So there's a lot of thinking going on. There's a lot of support being offered. Just 2 last points in terms of connections. I think you've heard this before, but if you have staff, if you know people who need help, please don't forget about 211. That is the place you should call to get connected to services. If you have staff that want to volunteer, I've heard, we've had some conversations with some businesses who have staff they've been paying, applause to you for paying them, but they don't necessarily have anything for some of the staff to do at home. There are ways that they can support these feeding programs and other agencies, even from home. So if they have volunteers that are willing to go out and help at a food distribution, you can get connected to that. And if you want to be able to, say, do some data entry work or make phone calls to seniors who are home or check in on veterans, there are ways that we can connect you to that service. So if you could reach out to Hands on Broward or contact me and we'll get you connected to those agencies so that you can continue to help your community. And I'm available for any questions.
Thank you, Cindy. You have really kind of provided a reality check, something to think about as we contemplate all the domino effects and ripple effects of this pandemic. This certainly was one that was something that you just awakened for us. So you did answer most of the questions that have been provided, but if I can just reiterate, what I'm hearing from you is that employers will need to be aware and make accommodations for employees, because finding childcare, early learning care, daycare is going to be extremely difficult when we start with reopening. Is that fair?
That is a very fair statement, and that is likely to go on for quite a while. One thing I didn't mention is many of these childcare providers may not survive this. In an interesting twist, the state has been terrific. The federal government, through the CARES Act, and the state has relaxed a lot of the requirements to allow payments to those centers that typically serve children who get the subsidized care, so that they do still have some income coming in. But those that were completely private have had no income coming in if the families, obviously the families haven't been going, and I'm assuming they haven't been paying. So those are small businesses as well, and they may or may not be able to turn the lights on when all of this comes back. The childcare industry operates on a very thin margin, and so that is going to be a challenge for them. So yes, I encourage you all to have patience with your employees who have children, because this is going to be a long, tough slog. But we're on it. We're working on it.
Okay.
I don't want to be all doom and gloom. Everybody's doing the best they can. And one thing I'll say about those who serve children, that commitment comes from the heart. And if there is any way that they can do it on whatever the thinnest of margins is, they will be there for the children that they serve, because it is a calling. It's not just a business.
Well, thank you for pulling us right back up there. We were getting low. But, knowing people like you, individuals who are so committed to helping the children, I know that you're going to be right in there trying to figure out solutions to this. So thank you so much. Well, we are really at the end of our time here. We have to thank all of our presenters here. Your insight and guidance have been extremely helpful, and thank you to each of you for what you're continuing to do to help our community through these times. So to close, I would like to call on Bob Swindell, my current boss. He says I'm his boss, but it's not true. The Greater Fort Lauderdale Alliance. Bob? You're on mute, Bob.
Thank you, Juliet. Still working on the technology. I'll be a Zoom expert by the time we're all no longer using the product. But thanks again for all your effort and the amount of time that you've put in helping guide us through this very, very unprecedented time in our economic and business lives. I think Dr. Fernandez made a great point. And when we look at the number of cases in Broward and South Florida, those are the number of folks that have been diagnosed, but a huge majority of those folks have recovered and are back home, and they're safe and healthy again. So as we look at those large numbers, we have to remember that our healthcare folks have done an amazing job in helping people pull through, and we're obviously mourn the folks that have not successfully recuperated from the virus, but so many have, and we owe a big debt of gratitude to folks like Dr. Fernandez's team at Baptist and all other healthcare providers in Broward. As we look to the future, and that's a big part of what we do at the Alliance, and I know the business community on here feels the same way. I think city did a great way of bringing us back and knowing that, the social safety net in Broward is made up of amazing individuals who are committed to providing help for our young people and making sure that they don't feel an outsized weight from this entire crisis. And we know that there's going to be a lot of telehealth and mental health care that's going to be needed as we recover and pull ourselves out of this economic and health crisis. On looking to the future, this morning, Stacy Ritter, who is the CEO of our Broward County Convention and Visitors Bureau, did an amazing launch of what they're going to be doing as businesses can come back online, and we look to promote Greater Fort Lauderdale and Broward County as a destination. I'd encourage folks, if you didn't see it this morning, go out to YouTube and you just Google or search for Future in Focus. You can see the presentation that Stacy and her team did. They've got a great game plan for our recovery and how our community will be able to bounce back from this very tragic episode that we've all been forced to go through. But it really is about recovery, and we want to move from the preservation of business, which we've been working on for the past 2 months, to recovery and growth. And I think we're on a good game plan to do that. One of the things that we're trying to do to help that is a 90-day campaign that we're launching with our chambers of commerce, our key partners on the Convention and Visitors Bureau, Broward County, our small business economic development folks, and that's I Love Local 2020. It's designed to be our campaign for local businesses to give our local economy a shot in the arm. You'll be hearing more and more about this, but you can visit ilovelocal2020.com. Our team has done an amazing job under our 6 Pillars Broward effort in putting this campaign forward. But again, it's designed to build confidence in the consumer. I've talked to a lot of business owners, and they are serious and have the same level of commitment that Cindy talked about with our healthcare and our youth providers. Those business owners, they know that they've got more to risk than anybody if we don't do this in a smart and careful way as we resume business and allow folks to begin to exercise what we normally would do as consumers in South Florida. But I'm really impressed with the operators and the standards that they're developing for their employees. They're common sense, but they will definitely be effective, and they're depending on the advice of our medical professionals on what these standards and guidelines should look like. So I'm very optimistic when I talk to hoteliers and restaurateurs. They want to come back, but they want to come back in a very safe way, and they want to make sure that their customers and patrons are not put at risk. So there's a lot of things to depend on when we want to move forward, and I think that if you go to bizhelpbroward.com, we've got actually these previously recorded town halls are there, but as well as all the information on resources for small business and businesses to begin to plan for the recovery side of this. We're very fearful of the number of small businesses that have been impacted by this whole COVID crisis and the shelter at home. But we want to make sure that the tools are available to business, and bizhelpbroward.com has that information for businesses. And we'll continue to add to that as more recovery programs become available for small business. But thanks again to our speakers. Thanks again to all the participants that were part of today's town hall. We hope these continue to be valuable for business leaders. And again, my thanks to the Alliance team for all the work that goes into putting these together. Thank you, Madam Chair.